I would like to welcome you all to the System Podcast where we talk about anything medicine. And this is the Pediatrics Revision Series. And today we'll be talking about the management of diarrheal disease. As you all know, in medical school, there's a stipulated outline which is being followed in the management of every disease. And this, I'll briefly go through the outline. This outline is introduction. That is, you introduce what the disease is, history, physical examination, which is divided into general physical examination and systemic examination. Then, of course, diagnosis or differential diagnosis, and investigation and treatment. Now we'll go straight to the program. The introduction. I would like to introduce diarrheal disease as this. It remains a major cause of morbidity and mortality in children, especially in less developed countries of the world like Nigeria, India. It is the most common cause of death among hospitalized children under 5 years of age. Acute diarrhea kills by causing dehydration, so you have to know that dehydration is the most common complication of acute diarrhea. So this dehydration leads to hypovolemia, which is reduced blood volume, and metabolic acidosis, which is increase in the acidity of the blood increases due to metabolic cause. Definition of dehydration. Dehydration simply means a change in the consistency of the stool to being abnormally loose or fluid, an increase in the frequency of stools more than is normal for the age of the child. Now I'd like to clarify some things here. Here we say change in the consistency. There is a normal consistency based on the age of a child. If you are dealing with an infant, they can defecate up to 5 times a day, which is normal. But if they are above infant level, then they should defecate maximum of 3 times a day. When it's beyond that, then there's change in the consistency, or we can say increase in the frequency. Now, being abnormally loose or fluid, defecation is normally is semi-solid. The stool is semi-solid, and in the case where it becomes loose, directly loose or fluid in nature, an increase in fluid or loose in nature, it's trying to signify diarrhea. So increasing frequency, as I said, the normal frequency, infant 5 and above infant 3. If there is increase in this, you are most likely dealing with diarrheal disease. So we'll go straight to the history. Now, history is also known as symptom. This is what the patient tell you, and as you ask the patient some particular question in relation to what you expect to see, this is what you get from the patient is the history. Now, obviously, you need to know that medicine is an art. It's not something written in stone that a patient must come in this way at all the time. Depending on the most pressing symptom, they might present late or early, and if they present late, what you might see, what they might tell you first might be different from if they present early. But uh, the consistent thing that you'll definitely find in a patient with diarrheal disease is passage of loose stool. They will definitely tell you that they pass loose stool, and vomiting, which can be before a day before the diarrhea. Now, passage of loose stool, uh, you have to probe to know the quantity and quality of the stool. Quantity in the sense that you can quantify based on a known size. Like you can ask them based on a sachet of pure water also, and the quality, like is there blood in the feces, like the nature of the feces, uh, and is it immediately after eating meal that they are defecating, and they are defecating just directly the meal they eat. So you need to try to probe all those things. Is there blood in the stool? Blood in the stool can be telling that this is an invasive diarrhea, and it can also lead to the fact that trying to tell you that you are dealing with dysentery. Now, for the vomiting, you also have to probe for the volume and the quantity of the vomitus, and you have to know if it's projectile. Projectile vomitus can be telling you that you are dealing with an obstruction, and you want to know if there's blood in the vomitus. You want to know if it is just ingested food they are vomiting. So it's very important. Fever is another consistent symptom. As you all know, the most common cause of diarrhea is virus, and the hallmark of infection is fever. And the fever is just simply increasing body temperature above 37.4 degrees Celsius. And this fever, particularly, can cause febrile convulsion, especially in case of Shigella. Abdominal pain in a child that can speak. Uh, Abdominal pain, blood and mucus in the stool can suggest invasive organism when you have those things: abdominal pain, blood, and mucus in the stool. Now, the next thing that follows is trying to elicit the sign, physical examination, what you can see as a doctor. This is a skill that you have to have, and we'll do a series on. We'll talk about that part of the series, but here we'll just be saying the things which you are expected to see. Now, on the general physical examination, the normal routine general physical examination, you can see on inspecting the patient can look lethargic, the patient can have apathy, like the patient can be irritable depending on the level of dehydration which the patient have. And next, the next thing we'll talk about is palpation. Now, on palpation, like um, we would be able to like elicit some signs of dehydration. Checking for dehydration have some specific steps, which some of the steps are part of general examination. Some of the steps are part of cardiovascular and other things. So we would actually do a podcast on that, particularly an episode on that. So here we just want to briefly talk about the things you can see. So the next on the anthropometry aspect, there can be loss of weight. As you all know, based on the loss of weight, also we can classify the type of dehydration. Systemic examination. The first system you would want to examine is the digestive system, as it is the most commonly affected in diarrheal disease. Now, in the digestive system, the child might have a distended abdomen, which is filled with gas, and the child might have an overactive bowel. Um, then next, you would want to do a neurological examination to rule out CNS infection, because most common infection in children is meningitis, which is a CNS infection. Cardiovascular system, as you all know, in trying to classify the level of dehydration, some cardiovascular system examinations will be employed, like blood pressure and pulse rate. So it's very important to do a cardiovascular examination. So finally, and in this episode, we'll talk about the diagnosis, which is mostly clinical. Now, the diagnosis is mostly clinical, being that you can be able to diagnose diarrheal disease by taking your history and physical examination, or other examination are being done like other investigations are being done um like full blood count to check. You might see leukocytosis. You can also do stool microscopy culture and sensitivity to be able to know the organism which cause it, and to prepare the antibiotic for treating and killing the organism. And you would also want to rule out other things, and you also want to assess for dehydration, to be able to treat the dehydration properly. So for this episode of the System Podcast, this is what we will be talking about. This is where we'll stop, and we'll continue in the part 2 of diarrheal disease. Thank you very much.